Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. CMS is taking a major step towards expanding access to weight loss and diabetes medications with the launch of a new pilot program called the Balance Model, short for Better Approaches to Lifestyle and Nutrition for Comprehensive Health. The model aims to expand access to select GLP-1 meds, along with evidence-based lifestyle and nutrition supports for Medicare Part D and Medicaid beneficiaries. CMS officials say the goal is to help Americans prevent and manage chronic conditions like diabetes, cardiovascular disease, and obesity, conditions affecting more than 70% of U.S. adults. Under the Balance Model, CMS will negotiate directly with GLP-1 drug manufacturers to lower costs, focusing on guaranteed net pricing, potential out-of-pocket limits for beneficiaries, standardized coverage rules, and required lifestyle support programs. The model builds on CMS's earlier drug affordability efforts, including the GUARD and GLOBE models, signaling a broader push to address rising chronic disease rates through both medication and prevention. State Medicaid agencies can begin participating in May 2026, with Medicare Part D plans joining in January 2027 and will run through December 2031. In what's being called the nation's first immersive memory care living program, a medical student's taking dementia education out of the classroom and into daily life. A first-year Michigan State University medical student moved into an independent living apartment at Holland Homes Raybrook Senior Living Campus in Grand Rapids as part of a new intergenerational living initiative. The pilot program, created through a partnership between the Dementia Institute and MSU's College of Human Medicine, places future physicians alongside older adults to deepen their understanding of Alzheimer's disease and other dementias. Living on campus, she engages with residents across all levels of care and spends focused time in the community's memory care unit. Program leaders say the experience offers rare hands-on learning and will shape how the student practices medicine for years to come, while residents benefit from meaningful intergenerational connection and expanded focus on person-centered dementia care. Living alongside residents could transform the understanding of dementia in ways that no textbook could. Early success in the program has already sparked plans for expansion, as leaders emphasize while medical advances continue, the power of human connection remains central to dementia care. New federal data shows Medicaid long-term care is increasingly happening at home, not in institutions. According to newly released CMS reports, more than 8.4 million Medicaid beneficiaries received home and community-based services, or HCBS, in 2023, far outpacing the roughly 1.5 million people who received institutional long-term services and supports. Of those receiving institutional care, more than 85% were served in nursing facilities. But CMS says the share of Medicaid long-term care users receiving HCBS reached an all-time high in 2023, as states continued efforts to rebalance care away from institutions and towards home-based options. While Section 1915C waivers, commonly used for AL and community-based supports, served about 23% of HCBS beneficiaries, they accounted for nearly half of all HCBS spending nationwide, totaling more than $70 billion. Overall, HCBS spending reached nearly $146 billion in 2023. The data also highlights wide variations by state, with places like Oregon, Wisconsin, and Minnesota leading the nation in HCBS utilization, while others continue to rely more heavily on institutional care, underscoring how Medicaid long-term care looks very different depending on where you live. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.